I'm Robert Weldon, and I shall be doing a head-to-toe assessment on my patient Kelly. I have already done the Snellen chart for her, which her vision was 20/20, meaning she can see at 20 feet what a person with normal vision could also see at 20 feet, and this is cranial nerve 1. Now, as she walked in, I also assessed her gait, which was very smooth and fluid and straight. Her orientation was ×3. Her speech was clear, articulate. Her attire was appropriate for the weather and for ethnicity because, well, y'all know how that goes. But this is South Georgia, so it was very appropriate. Now, I shall go see my patient. So, I'm going to close the curtain for privacy of my patient. Close. Okay. Hello, I am Robert Weldon. I shall be your student nurse. I shall be doing your head-to-toe assessment today.
Okay.
Now, I'm going to try and keep it under 30 minutes, okay? If you need to take a break, let me know, though. As I walked in, I saw that your head is almost cephalic and all. You have no abrasions, lesions, cuts, anything like that. But if it's okay with you, may I palpate your head? Okay. So, her head definitely is normal cephalic. I do not feel any bumps or lesions or anything like that. Her hair is healthy and normally distributed. Sorry, I just pulled out a hair. I apologize. So this is healthy. Now I'm going to check your sinuses. So your frontal sinuses. I do not feel any enlargement. Do you have any pain?
No.
No pain? Okay. Your maxillary sinuses. There's no enlargement. Do you have any pain though? No pain at all? Okay. Now I shall assess your skin by to see exactly how warm you are. Will you please turn the light? Thank you. You are bilaterally warm, so it is even. That is wonderful for you. I'm going to go ahead and assess your. I shall assess her neck now to see if her trachea is midline. So her trachea, it is midline. Yes, it is very midline as well. Now I should also see about her lymph nodes. Let's see, you have pre-auricular, post-auricular, occipital, submental, mandibular, tonsillar. You have your superficial cervical chain. You have your deep cervical chain, your posterior cervical, and then you have your supraclavicular. And I do not feel any enlargement or swelling of your lymph nodes. Was there any pain at all? There was no pain. Okay, well that is wonderful. Now I shall assess your thyroid. So I'm going to come behind you. Will you please flex your neck down for me and turn to the left? Okay. Will you please go to the right for me? Okay. I'm not feeling any enlargement or swelling of the thyroid, so that is healthy and normal. Now I'm going to. I'm sorry, I forgot my stethoscope. Sorry, y'all. Okay. Now I shall check her carotid pulse. So now I can only do it one at a time to make sure that I do not cut off circulation and her pass out or anything like that. So that is a 2+. That is a 2+ as well. But now I'm going to listen to hear if I have any bruits. Now, if you would you take an inhale and exhale and hold it? Sorry, I did have it switched. I had to use the bell. I apologize. Breathe in again and exhale and hold it. Yes, that is much better. Okay, breathe in and exhale one more time for me. Yes, that was definitely much better. Sorry, with the diaphragm I could not hear it, but with the bell it was much easier to hear with the buoys and stuff. So do some tests for you for your cranial nerves. Okay. Will you please raise your eyebrows? Okay, cool. That is cranial nerve 3 intact, letting you know. Will you please smile for me? Now frown. Don't make a blowfish. Okay, that is cranial nerve number 7 right there for you. Okay, now will you clench your teeth and resist my pressure? Okay, no, same, resist it. Okay, that is good. That's cranial number 5, but I got to do one more test for that. I'm going to touch you with this cotton ball, and you tell me if you feel it or not. Okay?
Yes, 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 yes.
Okay, she could feel it. That is cranial number 5 intact. Now will you say light, tight, dynamite?
Light, tight, dynamite.
Okay, that is good. That is cranial nerve number 12 intact. Okay, so now I know I put them gloves somewhere. Oh, there they are. Found them. So now I'm going to be doing the oral assessment. I should probably get some. No, these gloves are fine. So they're a little tight, but whatever. Okay, so for your oral assessment, I'm going to do the T&J, okay? And I want you to clench your teeth. And I'm going to see if I can clip this at all. You don't got to clench them yet. Okay, now clench them. Okay, so now move your mouth down, up. Now move to the left, right, up, out, now back in. Now there's a little bit of crepitus, but that is okay. But that is good. Now I shall check the inside of your mouth. Let's see, open wide for me. Now as I'm looking in here, I see the hard palate and the soft palate. That is both moist and pink. Will you please say "ah" for me?
Ah.
Okay, that is cranial nerve number 10 intact. I see your uvula back there, your tonsils. They are 2+. I see your Stinson's Duck and Warren's Duck. Okay, will you please raise your tongue? Get it out of the way. Thank you. I see the frenulum right there, so that is wonderful. Okay, now I'm going to do the gag reflex with you, okay? And this is testing cranial nerve number 9, so let's see how you like it. Open wide for me. You ready? Cranial nerve number 9 is intact, as y'all saw. Okay, so now I'm going to be doing a taste test, so she doesn't know what I have in my hand. Will you please? Yes, ma'am. Open wide for me, okay? And you tell me what you is. Hold on. Raise your tongue a little bit. Okay, there you go.
That's sugar.
Good job. Okay, so that is all for the oral exam. Her lips were very nice and pink. You know, there were no cuts on it. I'm not kissing you. So there was very smooth, elegant. There is no lipstick on them or anything like that as well. Okay, now I shall be moving on to the nose. Her nose, isn't this a pretty nose? Okay, yes, such a pretty nose.
Thank you.
But it's very symmetric. There was no bumps, no lesions. Yes, very nice. You do not have a witch nose where it points out really far as well. But now I shall inspect the inside of your nose. So if you would turn over here for me as well. Let's see. Now I'm going to be checking the inside of your nose now right here. Let me. Okay, it is very pink and moist back in there. There's some hair, your mucosa. I mean, it was very well. But your nasal septum is not deviated. Yeah, it's definitely not deviated on either side, but I'm going to take this nasty thing off right now because we do not want that anymore. That is disgusting, okay? Actually, I should have taken my gloves off before that, but until I did the oral exam, but I'm taking them off now. So, okay, so now that I've done your nose, oh, by the way, the smell test, that was for cream. I have not, the taste test, sorry, I apologize. For the smell test, I'm about to see how well, can you close your eyes? You don't need to see this, close your eyes, thank you. Okay, so for the smell test, I'm going to see, this is for cranial nerve number 1. Now will you tell me what you smell?
Alcohol.
Okay.
Alcohol.
Good. That is for cranial nerve number 1. Okay. So now I shall look at the ears for her. Now you have some, ooh, these are some pretty ears. Don't cover them up with your hair. Okay. But there are no abrasions, lesions, cuts, or anything like that. Yes. Now I'm going to rub your tragus. Tell me if you feel any pain.
No.
No pain? Okay. I don't feel any lumps, neither in the pinna or anything like that. Okay. Will you turn over here for me after you inspect the inside of it now? Okay, come here. Okay, So I'm inspecting the inside of the, oh, I'm sorry, I apologize. I'm inspecting the inside and there's no drainage or leakage or anything like that. I see the tympanic membrane is pearly gray, and the cone of light was at the 5 o'clock. Sorry, I had to think about that. I get my 5 and 7s mixed up sometimes. I'm going to put on another one. Whoops. Oh, okay, so let me check this one as well. Gotta make sure this one is okay. That is good. And that is the same. It is a tympanic membrane is a pearly gray, and the apparently I got caught. Sorry. Tympanic membrane is a pearly gray, and the cone of light is at the 7 o'clock on that ear, which is the left ear. I saw the malus and the sapies and as well. So now I'm going to do some tests for you to test cranial nerve number 8. I'm going to do the whisper test. Would you put your hand over your ear for me? Over here. Over there you go. Okay. Now I'm going to say something. You repeat what I say, okay? A, B, C.
A, B, C.
Okay. Now do the same thing on the other ear. I'm going to come over here for you. This way.
1, 2, 3.
Okay, cool. Now I'm going to do the Weber test. Okay?
Mm-hmm.
Now with the Weber test, I'm going to place this on top of your forehead, and you're going to tell me if you hear and feel the vibration in both ears evenly, okay?
Okay.
So,
Yes, I do.
okay. Now I'm going to be doing the Renin test, which I shall hit it and place it on your mastoid, and you'll tell me when you don't hear it anymore, and then I'll do air conduction in front of your ear, okay?
Okay.
And you tell me when you don't hear it anymore as well.
Okay.
Okay?
Okay. Okay.
That is good. Now let me check this ear as well for you. You ready?
Mm-hmm. Okay. Okay.
That is great. Now you heard air conduction better than you did bone conduction, as it should be. It was twice as long. So now, since I am done with the ears, I am going to go into the eyes. Now, ooh, those are some pretty blue eyes right there. But I see no cuts, no lesions, no bumps. That is wonderful. Now, unfortunately, I can't look at them. You have to look up for me so I can check your conjunctiva, okay? That is a nice conjunctiva. It is pink and moist, and all your sclera, it is white. That is wonderful. Okay. Now I'm going to do some tests with you, okay?
Okay.
I'm going to do some tests so I can test your eyes and see how well you do. Now, look straight at me, okay? Actually, look past me, okay? Now, I'm going to look past me, okay? I'm checking for the light. Now, I see the light in both eyes evenly. It's bilateral. That is wonderful. That is the corneal light reflex test. Now, I'm going to end up doing the cover test. So, I'm going to place this card. Keep looking straight at me, okay? There was no deviation. There was no deviation again, so that is wonderful for the cover test. Now for the confrontation test, will you please place, actually I'm going to give you a card and me a card. This way, if I can pick up the card. Oh, I got one card. I'm having trouble picking up the other. There we go. Okay, so for the confrontation test, place this over this eye, okay? Now, tell me when you see my hand, okay?
Okay. Okay. Okay.
Okay, now will you switch eyes? Okay, same thing.
Okay. Okay. Okay.
That is wonderful. Now that is testing, oh wait, no, not yet. Now I'm going to do the sixth diagnosis test. Now will you follow my finger, okay, without moving your head now, just your eyes. Good, now that is cranial nerves 3, 4, and 6, all intact. Now I shall go to the light accommodation, and I want you to look behind me, okay? I want to see if your eyes constrict. Yes, that one did. I'm going to let your eyes dilate. Let's check this side. Sorry. There we go. that I constricted. That is wonderful. Got some good reflexes with your eyes, at least. Okay, now, will you turn over here for me? I have to look inside your eyes and see. Okay, that is wonderful. Now I'm going to go at a 15-degree angle over here. Okay, I see the red reflex. I see the optic disc. It is a yellowish, orangish, creamish color and all. I see the arteries and the veins within the eye. Now, will you turn for me? Okay, I'm going to check this side. Will you please open your eye wider for me, ma'am? Thank you. Oh, I see the red reflex. That is a beautiful thing. I see the optic disc in there. It is the same as the other. Orange and the yellowish color is creamy, kind of. I see the, yeah, I see the arteries and the veins. That is wonderful. I'm sorry if that light bothers you now.
It's okay.
So, let's see. Did that. Okay, so now I'm going to be listening to your heart, the different valves of your heart. There are 5 of them. I'm going to end up. There we go. Okay, so letting you know I will be having to go down and underneath your shirt, but I should be listening to 5 different places.
Okay.
So I'm going to go down first. Okay. I'm listening to the aortic. Going over to pulmonic. Okay. Now I shall go up underneath, if that is okay with you. Okay. I shall be listening to Erb's point, tricuspid, mitral. Okay, that is wonderful. When you listen to the valves of the heart, you normally hear the lub dub, which is S1 and S2, which you hear S1 more in the aortic and you hear S2 more in the mitral. I did not hear any bruise, swishing sounds or anything like that, or any extra lub dubs, which would be S3 and S4. Now I shall be assessing her chest and thorax. So I have to take this back on. Oh, by the way, your chest and thorax area is it is symmetric for your ethnicity and stuff like that. Now I shall be assessing your bronchiovascular and vesicular sounds. So I'm going to have to go underneath your shirt. The bronchio sounds, they are more in the upper area, they are more high-pitched and louder, while the bronchiovesicular, they are more of a moderate sound overall. The vesicular sounds, they are more of a lower sound and a softer pitch. But now I shall be assessing your back, so you do not have to turn around, or I will go behind you, I'm sorry. I shall be checking respiratory expansion, so if you would please breathe in for me. That is wonderful. My thumbs both spread out evenly. Okay, so now I shall auscultate. So I shall auscultate from the back. I'm going to be going up and under, so please breathe normally. That sounded wonderful. It sounded a lot like her bronchio and bronchiovesicular sounds in the front. They sounded about the same. Now I shall be doing the. Oh, I'm so sorry. I forgot the percussive. So. wonderful. Now I'm going to do the tactile affirmatives, and now I'm going to touch you, and every time I touch you, I want you to say 99 for me, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, that is about like the bronchiovesicular sounds and the broncho and the vesicular sounds earlier, how as you are more superior, it is louder and higher pitched, and as you grow lower, it goes more duller over time. So now I shall do your capillary refill, so please, let me see your hands. Oh, those are some great hands. Okay. Now it should take about 2 to 3 seconds for the refill, okay? So, and it did, so that is wonderful. Now, if you would you please lay back for me? Okay, so I'm going to be checking your abdomen now, so I'm going to be lifting up your shirt. That is fine. Her abdomen is very flat, so that is wonderful. Now I'm going to be listening to the bowel sounds. So I see no abrasions, lesions, or cuts. Do you have any pain in your stomach? No pain? Okay. If the patient did have pain, then I would save that quadrant for last. But since she doesn't, I shall go in order. I shall start with the right lower. Go to the right upper, left upper, left lower. Now I'm also going to go ahead and auscultate the arteries. So the aortic, right renal, left renal, right iliac, left iliac. Now I am going to have to go under a little bit. Right femoris, left femoris. Okay, that is wonderful. With the bowel sounds, if I did not hear anything, I would continue to listen for an hour. I would continue to listen for about 5 minutes in each quadrant, but since I did hear bowel sounds, then I was just able to progress normally. Now I shall percuss. Now, over her liver, it was more of a dull sounding because it is more dense, but over the stomach, it was more of a tympanic sound because it is hollow like a drum, which makes it pretty fun because I can sit there if I wanted to. But thank you, that is wonderful. Let's see. Oh, now I shall be doing light and deep palpations. So, light palpations. No pain, breathing on that? Okay. Now I shall be doing some deep palpations. Now I have not felt any enlargement or swelling of the liver or of the spleen. Now if I did feel an enlargement of the spleen, I would not want to actually determine the size or anything like that because it would explode. But she is good. There is no enlargement, there is no swelling of any sort. I'm going to lower your shirt now for you. That's wonderful. Now will you please sit up for me now? Come to the edge of the table. Okay, now I'm going to be doing the kidney test, so I'm going to have to, tell me if there's any pain or not. You will feel me hit you. Well, I'm not hitting you, I'm hitting my hand on the back of you. Tell me to let me know, okay? No pain? Okay. No? Okay, good. Okay, so now I'm going to do some muscle strength testing. Will you please put your arms like this for me? Okay, now I'm going to pull and you resist me. Okay, now I'm pushing, resist me. Okay, I'm going to do the same thing with your legs now, okay? Okay, that is wonderful. Okay, now I'm going to be testing for your pulses across your body. So, I'm going to do them at the same time. That is about a 2+ right there. I'm going to...
Sorry.
That is perfectly fine. No big deal. 2+. Now this is the brachial and this is the radial. Now, ma'am, would you please, or I'm going to take your shoes off for you actually. I'm going to be nice.
Thank you.
Okay.
My feet probably stink.
No, not at all. Okay, so now I'm going to be testing the pulse of her dorsalis medius. And then I shall also assess the pulse of her posterior tibial. And they are both about a 2+, so that is wonderful. Now, ma'am, will you please stand up for me? Okay, now I want you to walk forward, heel to toe. Okay, now walk backwards. Okay, thank you. Okay, now I want you to close your eyes, and I'm going to have my hands right here for you, okay? Just stand still, close your eyes, keep them closed, don't look, don't try to look, no peeking. Okay, you're good. That was the Romberg test, and the walking was the tandem test, and the standing with the eyes closed, that was the Romberg test, and that was to see if there was any swaying, which she had no swaying, so that is wonderful. Now we shall do range of motion for you, okay? So, will you please place your neck down for me? Now extend it up. Okay, now would you laterally bend to your left, to your right? Now will you rotate your head to your left, now to your right? Thank you. Now there was no crepitus there or anything like that and all. Now with your arms, would you please, actually I'm going to do your spine first, okay? Will you please bend over for me? Okay, that is flexion. That is extension. Thank you. Now will you bend laterally to your left for me? Bend laterally to your right. Okay, now rotate to your left. Rotate to your right. Rotate to your right without moving your hip. Thank you. That is wonderful. Okay, so now I'm going to do your arms, okay? Now with your arms, I want you to flex and then extend, okay? So flex, now extend. Now I want you to raise your arms up, which is abduction, and then bring them down, adduction. Okay, now I want you to do external rotation, and that's just putting your hand behind your head, or actually put it on your shoulder blade back here for me. Thank you. Both arms, please. Thank you. Now with internal rotation, you're going to end up doing the same thing, but there you go. Thank you. Put them a little bit higher for me. Thank you. That is wonderful. Okay, now for the elbow, I want you to flex, or no, that's extend for me. Okay, now flex. Now extend. Okay, that is wonderful. Okay, now put your hands out for me. Okay, that is supination. Fold them in where your palms are face down. That is pronation. Okay, that is wonderful. Will you please take a seat for me again? Okay, now will you please lift your legs up? That is extension. That is flexion. That is wonderful. Okay, now with your foot, now would you press the gas pedal down for me? Okay, that is plantar flexion. Now release the gas pedal. That is dorsal flexion for me. Okay, now would you bring your toes in? That is inversion. Bring them out for me. That is eversion. So that is wonderful. You have full range of motion. Okay, I shall do the. Okay, so I wanted to be doing your deep tendon reflexes now. Now, let me take you on. Now I'm going to do your tricep. So, okay, there's her tricep. That is wonderful. Now let me see about. This is your bicep. There we go. I'm going to do this arm as well. Hold it up for you. That's good. Bicep. Okay. Now we're going to do your plantar, or your patella, not plantar. Patella. Sorry. Is that one? There's that. Okay, now for your Achilles, I'm going to use the flat head because I don't want to hurt your Achilles and use the pointed side. So hold your foot. There's that Achilles. There's this one. There we go. That's that Achilles. Put that right down.